Welcome, and today we're going to talk about solutions that RTLS can bring in this COVID-19 crisis, RTLS in general and Omni in particular. This is the second in our series, While We Sit at Home. Figured take advantage of this opportunity and run through some interesting webinars with you. So coming up, again, you can have a look at this list. I'll share this PowerPoint, so if you have specific requests, please send them to me. I'll be happy to entertain and to add them to the list. So what are some of our solutions in this COVID-19 crisis? So first is contact tracing. That's become a buzzword, and you need to know, for example, here in Israel, they are quarantining, they are isolating a very large percentage of healthcare workers out of doubt of whether these people actually came in contact with the various infected patients, and they need a tool to better define who was with this patient, who came close to this patient. So they want to see, okay, they have a room or a patient that has been infected. Let's see which caregivers came in contact with this patient, right? So that's called contact tracing. And not only staff, but also equipment, right? So if you have various hospital equipment, particularly now we have the ventilators, right? The respirators, then let's see which ones were in rooms with infected people. If so, we mustn't move those to another patient until we've sanitized that particular asset. And then we have makeshift hospitals. So you've got a lot of hospitals coming up, being built quickly, facilities being made ad hoc into healthcare facilities, and they need to quickly equip them with various applications such as nurse call, right? And how we can quickly bring a nurse call into a new hospital without too much cabling, without too much expense. The third is the staff duress. Okay. In the case of COVID, we've got a lot of disgruntled, where there's limited resources. So you've got loved ones, family members that are going to become violent in order to get care for their loved ones. So that's staff duress. That's a big deal. Patient capacity management. You need to have an overview of your hospital, see where you've got capacity, where you don't, how many patients, et cetera, and as well as resources, where they are located and if they fit within the operational boundaries. Hand hygiene compliance is something that's important now, of course. So a lot of these solutions that we've been offering independently are now very much in need to deal with this crisis. And some others, for example, environmental monitoring is another application that we provide both for temperature and pressure, and searching for assets, that's all cute, and many others. So we've got a lot of applications. The first one is contact tracing, to alert when a staff member comes in contact, perhaps unwittingly, with an infected patient. And we also need to inform the general management, right? So we have two means in Omni of doing that. We've got the location alert, so we can define a room, which is within the, let's say, isolation group, the rooms which are dedicated to be used for isolating patients. And we have the co-location alert. That means we want to know when a patient is mobile, is ambulatory, right? So he can move around, then we want to know when a staff member came in contact with him. Let me quickly demonstrate that for you guys. Here I've got my staff member, that's Dr. David. Here I've got a room. There's room 2, room 3, room 4, 102, 103, 104. And when Dr. David moves into a room that is currently occupied by an isolation patient, then my co-location alert is going to pick up on that, because it'll see that David is now in a room with an isolation patient.
Staff with isolated patient.
So there we got
Staff with isolated patient.
So we've got it a few ways. We've got it, of course, in the Omni Go. and we've got it in all the other. It's a regular Omni alert. As opposed to this room here, which I've defined as a room which is in a group dedicated for isolation. So
Staff in isolation room.
in this case, when I move my tag
Staff in isolation room.
up
Staff
to
in isolation
room 104, then the alert that we're getting is this staff in isolation, because that is a location alert, right? So I've got two kind of alerts: in isolation room, which is simply an alert that you select the group of isolation rooms, versus the staff with isolated patients. In that case, that's a co-location alert, where in the inputs you see you've got group A and group B. So here you'd have staff or isolate, and the other would be the isolation patients. So we have staff selected on one side and isolation tags on the other. And that way, I can also easily move rooms and assign a room to be an isolation patient, meaning I could put the tag could just be the means of saying this room is now dedicated for isolation. So if I take my isolation room tag and I move it up to the next room, then I see on my map that this room is now an isolation room, and Omni will alert when a staff member enters that room, right? And I could do the report on the co-location. So that's a neat way. Instead of having to go to a PC and saying, okay, this room is now part of the isolation group, I simply put a tag in that room. I say, now that's an isolation room, right? And you can visibly see it when the staff member comes. They'll see the tag hanging there. They'll know that this is an isolation room, right? So there are two ways. One is using the software to say, okay, this is an isolation room. The other is just putting a tag in there. Or, of course, putting the tag on the patient himself. That is with regards to the different means, the two ways of detecting that a staff member has come in contact with an infected patient.
David, it's Tim.
Yeah, Tim.
Just want to make sure I've got that in my own small brain. What you're saying here is that there are two ways of being able to identify a room as being a room for isolation. One is by physically doing it in software that says this particular room 102 is now an isolation room, so anyone going in that will be seen as entering an isolation room. The other one is by simply adding a tag to any room.
Correct.
And using co-location in that room to indicate that there's now an isolation room. So basically two tags together, those two tags are going to alert when one person is near another person that is under isolation. Now it's either the room that's nominated as isolation or the patient within the room is nominated by
Correct.
Isolation.
It's the same kind of tools, like we discussed last week with mother-baby matching
Yep.
Right? Similar concept. But here we've got a specific, actually the co-location alert was developed for the prison market for two gangs that mustn't go near each other, but this is legitimate application.
Same deal. So you logically what you'd be really doing here is just tagging the isolation patient so that anywhere they move and any person coming in
Correct.
their own space would then be breaching the isolation rules.
Correct. So
Makes sense. Okay.
if the patient is moving about, so then you can do that as well. And that becomes a whole complex contact tracing task, which is simplified using this tool. Right?
Great, thanks.
Now, another thing is that we're managing patient and asset flows. So if I have a look now at my my asset here, my ventilator, right? So if I think I might want to just use the EV2 here. And let me look at my ventilators, my respirators. Okay, there's ventilator 1. And notice, okay, that his status is active, it's fine. But when I move ventilator 1 into one of those rooms that I've defined as an isolation room, notice that the status of the tag is now exposed, right? And that means that the asset, that needs to be sanitized now. And the way I can indicate that it's been sanitized, I could take my handheld exciter, HLA, and simply press the button. And now I'll see that the status is back to active. So until then, if I try, if I'm in my asset search application, for example, then I will only search on active assets. If it's already been contaminated, right, then I want to make sure that it's not shown when searching for an available. It is not within the available list of status types for that asset, right? So that's an important piece of contact tracing as well for assets, and how we can manage the flow. Just if you watch the video to do with patient flow, you'll see that we use status types to indicate the step at which the patient is in within the process, and we're using that here. The same thing, and all of this uses auto actions, right? So the auto action meaning if an asset enters into a location which is considered an isolation room, let's set the status to exposed or to contaminated, and then only by having been sanitized and exposed to the handheld LF by the technician, by the biomed, then it will become active again and become available for use. And then, of course, the reports. So we have various reports. Okay, so we have the co-location report, which shows all the time when they came together, and it shows who at what time. And then the visit report saying, okay, if I've got specific locations, I want to report all the staff members that have entered that location at what times, then I can generate that report as well. All right, so we've got the history logging going on continuously into the SQL database. Okay, so that was the first topic. The second is handling makeshift hospitals. So we want to, this is the picture of the Chinese hospital, and they put it up in like no time. How are we going to create a nurse call system quickly for these hospitals? So first of all, and I had this conversation with you, Tim, so we can go in with RF only. And with RF only, meaning you just need a very minimum number of RF readers or access points, and then you can put tags around and use the tags. So the idea being that you have a tag assigned a location. And the tool that we use in Omni for that is the input, the wireless input. Right? So we can have RF coverage only, tag per bed, and a toilet pull cord via using the lone worker tag with a bracket. Right, so we actually have some customers. If you might be familiar with this plastic piece, it's actually the clip that we developed originally for the lone worker belt, but we've modified it, and now instead of having the little hook that goes around your belt, you have a little piece of stainless steel that is screwed into the wall. So you can now hang this upside down on the wall and use it as a pull cord for showers, right? You also have the wireless input. This is the TBA, which you can wire up to 3 buttons and connect it to this wireless input. Or you can use a regular tag next to the bed. Now, of course, if you have a wireless input, you can use, for example, a pillow button and attach that. So now we've gone in fully wireless nurse call system. Again, how are once the call is being placed, how is it being handled? Okay, it's being sent to the staff via the OmniGo. This is the app on Android or iOS. They get a push notification, and they come and they handle it, or they can get it on the web, of course. And then how is the call then canceled? So how do we handle nurse presence? So the handheld LF could be used for nurse presence. As far as the pull cord, they just push the hook back into the tag, and that itself will reset the call. And another option for nurse presence is something we've just introduced into the Loan Protect. It hasn't been released yet, but if necessary, we can. And I was actually just thinking it would be a good idea to add it to OmniGo. And that is using NFC. So you can put just an NFC sticker, costs, I don't know, $2 or whatever. You stick it on the wall, and then with their phone, they just basically present their phone to the NFC. That gives us presence in that room. That could be within the same map object as the input, which is the wireless input, and that would automatically close the call. So you have similar location. You have the same location using maps. Let me quickly demonstrate these for you. Okay, so we go to the alerts view, I've got this tag here. I say, okay, this is actually a tag which is connected, hooked on the bed. I push the button.
Needed. Nurse needed.
I'm getting a nurse needed alert. And here I get it on the map. So what's actually flashing here is an input that I dragged onto the map. It is not a tag. So it's stationary on the map. I don't need to do location. Therefore, I don't need to put an IR or an LF at that room. I'm just dragging. I added the tag. I don't know if I showed it to you. I added the tag in Omni. Your call points. You see, I'm adding them as Elpas fixed badge, which has an input, which has 3 inputs. One is for button 1, button 2, and then the motion, right? So again, add by type. I'm selecting Elpas fixed badge OEM. Once I've got those inputs defined for this device, right, then I can place the input on the map, right? It's just like any other input, like a wired input. So here we have the input on the map so that when the patient presses the button, the nurse sees this on the map, boom, 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 room, and it says in text, M110A button, but the bed A in room 110 was triggered. Now, how the nurse comes and the nurse wants to close the call. She has her HLA in hand. She simply exposes the tag to the HLA, and that, boom, closes the call. And we know, based on the ID of the HLA, which nurse closed the call. It's all recorded in the audit trail in the log, right? Alternatively, I also have in that room this guy, which is the lone worker tag, man down, got a lot of the Elpas shield, lots of names for it, and I'm gonna pull on the pull cord, and there I get that input. It's another input that's on the map, so it doesn't move on the map, right? It's stationary. It's not like a tag, but it's initiated using a tag. Here, what I'm going to do, I could theoretically use the handheld exciter, but instead I'm going to just put the plug back in the tag, and that cleared the call from Omni, right? So we have a nice little nurse call system that could be installed very quickly simply by using tags and a couple of RF. You can even use the long range, the high gain antennas, and each one indoors give you, I don't know, 40 meters or something like that with the Yagis if necessary. So with very few antennas, you can cover an entire site, and you just use the tags for nurse call. Questions? So escalation via app or staff tags, which I didn't mention. So again, if I do that call, right, I'm going to do my nurse needed call. This is my cell phone here, right? So if I look down at I've got my OmniGo calls here. Okay, so here's my, I've got my alert, and while I'm here, if I see now it's an emergency, how is the nurse going to escalate the call? So she's got on her phone, it's got the emergency call. She clicks on that, and now I got an emergency call from that user, from Dr. David. Right, so that's a means of escalating the call in Omni, but without, or you can actually just mount another tag in the room for emergency call as well as a button. Okay. That way I can not have to restart the beginning. Okay, and another thing is escalation via app or staff tag. Shift management with Omni Shifts. We have a whole application that we did. It's primarily for you guys, Adrian, up in Norway, where the shift manager has a nice UI on her phone. It's a web app, and she's able to say, okay, these rooms are should be sent to this staff member. These rooms to this staff member, and then if somebody calls in sick, she can make some changes as needed. So we've got that shift manager application, and when I do the session on nurse call, we're going to look into that at greater detail. Then we've got staff duress. That's another big application. This is David going back a couple of years before he went on intermittent fasting diet. Attacks by disgruntled loved ones, we said. Man down tags. We've got the squeeze. It's got fall detect with pre-alarm warning, and we've got the pull cord. All those options for triggering alarms, all wireless. Auto cancellation on arrival of staff. We've got the location cancel. Since I want to keep to the half hour, so we're not going to demonstrate. LF beacons for location. So again, we've got the CenTrak LF beacons with the CenTrak tags that are battery operated, or the Elpas, which basically an ALC you can just power. You doesn't necessarily have to be networked in order to excite the tags. So if you have just general RF coverage, then you can place these beacons by just powering them without having to run cabling everywhere, right? So that is a means of giving room level location and saves some cabling. I mean, ultimately you would want to supervise this, but if it's a quick fix, then you can get in pretty quickly. Hospital capacity and room occupancies, right? If I look at my badge view, right? So notice that on each room, each reader, it says the number 3, the number 2, even when the number of tags exceeds the number of icons that can be displayed. Like if this reader now has 15 tags associated with it, then it'll hide the actual icons of the tags and just show the number. And if I go up and I look at the maternity ward, I see the total number of tags in maternity, it says is 5. So I can see that in this ward I have 5, in this ward I have 0, etc. Right? So you can easily, at a glance, see where you have the number of patients in each area. We're actually doing now a new display, a new application for the web client that shows map and current attendees, or it's for the correctionals, if it's for a corrections application. So you can do a roll call very quickly, and that can also be used in this case. And in addition to that, we've got the quota alert or the par level alert, and say, okay, in these areas, you may have between this number and that number of patients, of assets, of whatever. And if it exceeds, if it goes above or falls below, you get an alert, right? That's the par level alert and report. We also have a report showing like a real-time inventory as to what is where, and then and whether it exceeds or falls below that number, right? So that's all in the asset. Have a look at the asset video and you'll see more details on that.
David, Tim, just quickly, when I think about staff workflow, is it possible to set par levels for staff? So you basically have a required floor ward to have a patient ratio of 5 staff members to 30 patients, or 10 staff members to 30 patients. Is it possible to actually set that ratio and create alerts around a ratio like that?
Absolutely. Yeah, it's the same thing. And in real time, you're going to get the alert. As soon as, let's say, you should have 5 staff members for this ward, and it falls below 4. Immediately as it falls below 4, you'll get the alert. Or if it's up to 10, if you have too many, when it hits that 11, it's going to alert.
I'm thinking more to the terms of not necessarily a requirement for 5 staff members for 30 beds. What I'm saying is to actually be able to manage your staff load depending upon the number of patients that are within a specific area.
We don't have that, Tim. I mean, it's something obviously that can be developed, but it doesn't exist yet.
Cool. All right, I'm looking at it from more an ED perspective.
Right.
So where we're talking about how many staff are required to manage the demand in ED. Well, the demand in ED is going to be driven by the number of people that are in ED. So I think that'd be a very valuable thing to think about.
Okay.
Always thinking of things that don't exist.
Shoot it off to me in an email, and I'll be happy to evaluate that with my team. Okay, hand hygiene. So we've both CenTrak and Elpas, we both had solutions, but the bottom line is that we can there are two means of monitoring dispensers. We've got the Gojo dispensers with their compliance module, and for regular pump dispensers, we've got a passive infrared that's made by CenTrak, and will determine if a wash has been performed. Simply, both of them work on the same principle of transmitting an LF signal to about 1 meter. So only when you operate or put your hand under and operate the device will it transmit the LF and then excite the tag, right? And what we do in Omni is we're using auto actions to change the state from active, let's say, in the active state, which is the default state, if he goes to a bed, then you're going to get an alarm. But once he washes, he does a valid hand sanitizer or clean, then it will change his status to clean, and at that point, he may approach a patient. We can also generate alerts like that, and then send the staff member using the email extension, if you're familiar. So you can define one alert for lots of staff, and then based on and the email extension will send to that particular staff member. Oh, there was you violated the hand hygiene guidelines, and then also have a report showing to do statistics on the compliance in general within the facility, right? Environmental.
David, is that driven by the same thing as mother-baby matching? Is it a tag? You're saying a tag that is now active because it's been the hand wash event has made it an active tag. Previously, it wasn't. How are you actually then generating that alert when the patient?
It's the same concept. It's the same concept. When you approach a bed, it's not he's approaching the tag of the patient. You're approaching, let's say, an infrared or an LF by the bed or the room. Okay. And then it's a location, and there's the same logic of the escort and I'm sorry, in this case, it's the status. The status of the tag will determine if there's an alert or not. If he's in the clean, no alert. If he's active, there will be alert, something like that. Right?
Okay. Cool.
And David, this is Israel. How can we do that using Elpas? We need to install one LF in each dispenser, or how can we do?
Both in CenTrak, they have these LF exciters. Elpas does not today, but you can theoretically attach an exciter. We're able to manufacture the ALAs in China if necessary, if there's a big demand. Small LFs, they've got an input. We actually have a firmware just for the ALA exciters where you can connect to an input. And then based on the input. So you can have a pressure sensor, for example, or a passive infrared, a third-party sensor wired to the input of the ALA, and it'll turn on the ALA, LF exciter, when that occurs and excite the badge. We've tested that. That works nicely.
Okay, understood. And on the other hand, is Planet in the roadmap any kind of compatibility between CenTrak and Elpas devices?
Actually, it should not be difficult to turn these CenTrak devices into Elpas because it's the same 125 kilohertz. So theoretically, with a slight firmware change, I can make these PIRs excite an Elpas tag. But right now, it's not on the roadmap because we want to see a significant business case for hand hygiene in Elpas. So right now, it's not on the roadmap. It's theoretically possible without a hardware change, same hardware. But yeah, good question.
I was thinking about in the case of, for instance, we have a hospital that they want to use hand hygiene and they want to use a newborn solution. Okay, so in this case we have to use different tags, different infrastructure, and this is not very good for the hospital.
I understand.
Mm-hmm.
Ok,
c'è la testa che è quadrata, non è normale.
Sorry.
Yeah. Okay. All right. Let's take that offline, Israel. It's a good point. And these during the partner forum, especially in North America, this whole issue was raised, and yeah, it's a good discussion to have. And again, everything is possible. It's just a question of business. Okay. Environmental monitoring. We're going to finish up here. Basically, negative pressure for rooms. That CenTrak has a full solution for pressure. Temperature, you've got the temperature monitoring with either Elpas or CenTrak, and the dashboard and the temperature alerts within Omni. The importance is monitoring the vaccines, the samples, the samples that are taken to check for the virus, and the pressure, as I mentioned earlier, the rooms are kept at negative pressure in order to prevent the virus from spreading out of the room. Yep.
David, have you checked the CenTrak DAP currently with the Elpas software? Is it ready to roll out? Because I've got an opportunity with that.
Well, we get those events and we can alert on them. We get the temperature, and the temperature has been tested to work correctly with our temperature dashboard. That all works. The pressure we don't have a dashboard for pressure right now, but for temperature we do. So we can use the CenTrak temperature solution together with Omni and use the Omni tools for visualization.
So the DAP sensor would only be just generating an
one
event.
time, right? Correct.
Yep, an event for over and an event for under or negative or positive pressure.
Right.
So that'd be similar to a button press event or something like that we
Correct.
just identify.
That's correct.
Cool.
Okay. Yeah. Any other questions before we wrap? Good. Okay, everybody. If you have any questions, again, you can email them to me, and we'll meet again. This is Monday, so Thursday is our next one.
Excellent. Thank you, David.
Okay.
Okay, thank you.
Thank you very much.
Good morning, everybody.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Ciao.
Goodbye.